China is scrambling to cope with surging infections after the country abruptly dropped its strict zero COVID policy. China's National Health Commission says nearly 18% of the population likely contracted the virus in the first 20 days of December. Health officials also warning a peak in infections may be reached within the coming week. Footage of what seems to be body bags piling up along walkways of a funeral parlor in the southwestern municipality of Chongqing. All these images providing a stark contrast to official figures. Authorities reporting no virus-related deaths for 3 straight days. Beijing also set to promote the gradual resumption of travel between Hong Kong and mainland China. That's according to an exchange between Chinese Premier Li Keqiang and Hong Kong Chief Executive John Lee. China is yet to fully scrap quarantine requirements for inbound travelers. All these comments come as a surge in COVID-19 cases threatens health systems across China. Still, China is insisting its domestic production of medical supplies is expanding and is sufficient. U.S. Secretary of State Antony Blinken says China had not requested additional vaccines. In fact, he says Beijing has not asked for any help. America's top diplomat is urging the Chinese to share information as suspicions linger over their COVID-19 numbers. He warns the global economy is at stake. And for more on the COVID-19 situation in China, Olivia Xiong joins us live from Chongqing. Olivia, Beijing making it clear it does not require any assistance from Washington. Another point of contention amid hopes of an improvement in bilateral ties.
That's right, Wei Su. The U.S. had offered specifically vaccine help. As we know, China is pushing for more of its population, particularly its seniors, who are seen as vulnerable to get vaccinated. The statistics show that about 40% of those over the age of 80 have received a booster shot, which is a relatively low vaccination rate. But as we know, China throughout this pandemic has not approved the use of any foreign vaccines here in China, particularly those mRNA vaccines, which experts say are key to helping manage the situation. Instead, most people here have been vaccinated with China's domestically produced shots, which the WHO says is less effective. But nonetheless, instead of receiving any assistance, China maintains that things are under control. It says that it had optimized its measures to become more effective. Here's what the foreign ministry had to say.
目前疫苗接种率不断提高，救治能力不断增强，医疗物资产能不断扩大，总体供应充足。中国疫情防控形势总体是可预判、可控的，相信中国人民团结应对，很快将迎来经济社会平稳有序发展的新阶段。
This also comes as we heard today that China's Foreign Minister Wang Yi held a phone call with his U.S. counterpart Antony Blinken, in which Mr. Blinken, according to the U.S. side, was said to have highlighted the importance of transparency given questions that have been raised about China's COVID data. But this was not mentioned at all in China's readout of the call. Instead, Mr. Wang reiterating China's position, saying that the U.S. can't talk cooperation while, quote, stabbing China, pointing to the range of tensions that still remain between these two countries over various issues.
Of course, Olivia, China's official stance on COVID-19 is everything is under control. But even so, health officials warning that they are looking at a peak of infections in about a week from now. Anything added to that in terms of the latest announcements?
China really bracing for a peak in infections, which they say will come next week. And this is really going to be a challenge and put pressure on the healthcare system here, which has already been stretched extremely thin, given the surge in infections that we have been seeing in the last few weeks since China rolled back its zero COVID measures rather abruptly, and the virus being left to spread mostly unchecked in the country. Now, Bloomberg report now reporting that it's possible that China estimates that 37 million people here could have been infected in a single day. There has been no official confirmation of this, but it is a staggering number. And it really does point to a mismatch with the official data, which only reported less than 4,000 new cases, for example, today. And as many people still continue to say that they are showing symptoms of COVID-19 but unable to get tested, as states testing has been scaled back and rapid tests, self-administered tests, are out of stock as well.
Oh, thanks for that. Olivia Xiong speaking to us there from Chongqing.